Well, I would say welcome all to this evening's meeting. Carol, you may recognize phone numbers better than I. You think we have quorum, or you want to call the roll and see where we fall?
Yeah, sure. I think we do have a quorum, but we'll call the roll and see how it plays out. Les Fremantle. Dennis Wood.
Here.
PJ Keeler.
Present.
Steve Meehan.
Here.
Steve Neer.
Here.
Was there a second rep from Greene County? I only have the one down.
There's an alternate rep, Gerard Laird, but he's not here. He only comes in my absence.
Okay, I wasn't sure if the second seat was filled. Okay. Kathy Allen? Kathy Allen? Okay, Ben Bornhorst?
Here.
Tracy Weir?
I'm here.
The second Saratoga County seat is still open, correct?
That's correct.
Jim Vina?
I'm here, Carol.
Okay. Alex Knowlton? Turning the page here. Dr. McHugh?
I'm here.
Dr. Daly?
I'm here.
Okay. Steve Kroll?
Present.
Anne Marie Cross? Okay, I am here. Lynn Kane? Jim Stairs is here. Dale Lingenfelter? Okay, Steve Retzloff?
Here.
Okay, Jeff Williams? Maria Walker? Charles Welch?
Here.
Okay. I think Ellen Bell's excused. Adam Fink?
Here.
Okay, Paul Segru?
I am here.
Okay, William Rockenstein?
Present.
Okay, and Richard Salucci?
I'm here.
Okay, and is there anybody else that I have missed? Let's see, Mary, I got a Dean. Okay. All right, let's see, 1, 2, 3, 4. Yes, we do have a quorum.
Excellent. Well, then we'll call the meeting to order at 6:03 PM. Pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Previous minutes are recorded, so we don't need to approve them. As Carol mentioned, Alan Bell is excused from tonight's meeting. Quite unusual. We all knew this was going to occur. Tim is actually on vacation. So to get his executive director's report into the record, I'll actually read what he has and what occurred when he sent you the agenda. So executive director's report, the Ahrams Remsco voted to approve the Remo Ahrams consolidation at their June 9 meeting. A resolution supporting that move was read into the record. There's still a few details to be worked out. Related to the above, on June 22, they met with Tom Pasquarelli, Ahrams chair, Phil Malidi, and Terry Hannigan. Excuse me.
Hey, Jim, you keep fading out.
Really?
Yeah.
And I apologize. Deb Cuffs has retired again, and Tim will obviously be looking to fill a front desk replacement position with Dave Galati moving from the front to medical standards. Remo summer class is in full swing with 35 original students and 7 refreshers. To accommodate that number, Tim worked with the landlord to negotiate some extra space. They were gracious enough to allow us to use the office across the hall from where Remo is at no additional charge. DOH has been holding bi-weekly conference calls with all the program directors as a way of briefing them on progress relating to the new operational contracts. And as of his report, the contracts have not been finalized. In relation to continued discussions and debate regarding EMT training costs, meeting was scheduled, or a conference call was scheduled on June 9 with several of the county coordinator or EMS coordinators to gauge their opinion on cost and how their county sponsors operate. I was actually, Jim Stairs, in attendance at that with Tim. While all the counties operated slightly differently when it comes to training fees, all of the coordinators who were supportive of Remo's training increase as determined by the Remsco. And just as an additional information, I guess, as part of the chair report, which would be the next item, the EMS coordinators who were in attendance at that were from Albany County, Rensselaer County, Saratoga, and Schenectady County. And, not to belabor it, obviously each of those counties do it quite differently. The takeaway was, to essentially, Remo should do what it has to do to, to make it work for Remo. If there was one takeaway that I'll bring forward to you guys is that they were quite supportive of us potentially continuing the course that we did in the past, where some of it was remote learning, because that apparently was well used by some folks in the county. So that's a good thing. But we'll bring up the actual action or the recommendations from that committee later on. And we'll just skip that. The next item would be issue discussions, but that will get that under old business. Next item under operational reports would be Dr. Daly for the medical director.
Thanks, Jim. Appreciate it. Actually, not a lot to bring to you today. Was involved in a couple of broad conversations over the course of the last several weeks. One today involving the pediatric ICU physicians, as well as the transfer centers from across the state, looking right the way across the I-90 corridor, down 88 to Geisinger and all the way up to UVM. It's not going to comfort anybody to hear, but the problems that we are facing regionally in terms of bed availability, the availability of units to move patients in a timely manner with the appropriate resources, all of these things remain huge problems right the way across all of this area. As we've seen over the last couple of days, from time to time, this brings us near crisis. I certainly am going to apologize to this group. We did have at 1.7 ambulances waiting on the ramp. That is inexcusable, but I'm still going to apologize for it occurring. As we've been in before, both of the tertiary care centers in the city of Albany are experiencing very similar problems. Certainly at Albany Med, we are facing problems with just sheer volume of patients through the emergency department and the acuity of those patients that get there. So my apologies to field personnel from the hospital side as we continue to all work together on this. And that's all I've got for right now, Jim.
All right, sounds good. What I was going to say, slightly out of order, but do you have anything you want to report relating to QI?
No, sir.
Very good. Dr. McHugh, REMAC Academic.
Yeah, we had a combined meeting this time. Focus was on getting the overdose data to police and other agencies to help with mitigation down the road. It's working in Schenectady, trying to get it to work elsewhere in the region as well. Also, I think the biggest part of it was rescinding the directive to park and wait outside until you have a bed assigned. So those were kind of the two biggest things we did, was some cleanup with as far as how to adjust the protocols and the method for doing that. And that was it for that meeting. Our next will be in September.
Very good. PJ, treasurers.
Okay, you all received the treasurer's report. Basically, just a synopsis here. Total assets are down about $42,000 from a year ago, which is a result of having to take $40,000 out of our investment account to put in the operational account to meet our cash flow needs. And as a matter of fact, our receivables are $50,000 higher than they were a year ago too. So if we had the 50, we could pay back the 40 and we'd be just about equal where we were last year. That's one of our continuing discussions as far as our classes go and the prepayment, which Jim says we'll get to afterwards. On the better side, we contributed about $11,000 worth of profit from our training program as compared to about $4,300 a year ago. So we're still okay. It's just a matter of robbing Peter to pay Paul.
Excellent. Any questions for PJ? All right, in terms of information sharing, several DOH disciplinary actions to read into the record. Caitlin Igme of Liverpool, New York State EMT number 452351 had her certification suspended for 1 year effective 6/14/22. The suspension is stayed pending successful completion of a 3-year probation without further violation. In addition, she must submit and complete a remediation plan as directed by the agency medical director within 180 days. And she was assessed a civil penalty of $2,000 for violations of Part 800.3 AM and 800.15 A2. Harris Chrome, Lake Grove, New York State EMT number 469744 had his certification suspended for 1 year effective 5/24/22. The suspension is stayed pending no further violations for 3 years. In addition, he was assessed a civil penalty of $2,000.
Jim, you're gone again.
Oh, how about now?
Gotcha.
All right. I don't know why. Weird. Back for violations of Part 800.3 AM. Mark Blackburn of Jerry, New York State EMT number 467799 surrendered his certification effective 5/17/22 for violations of Part 800.15 A2, 800.15 B1, 800.16 A1, and 800.16 A2. Course applications is just informational. Saratoga County Daytime EMT start date is 8/1/22. Location is Wilton EMS. The only correspondence was from Alan Bell requesting he be excused from tonight's meeting as he will be on vacation. Committee reports executive. We did not meet as an executive board, so anything we discussed would be part of this meeting. Finance, Steve Kroll. I was gonna say I caught him by surprise. Anne Marie, I don't believe is here for nurses. PJ, do you have anything MCI wise?
No report. We are planning a drill in Columbia County, probably in the early fall, late summer. We'll test the system at that point in time.
Sounds good. Our membership is still open. Let me try and bend somebody's arm and get them involved in that. Nominating Maria. Oh,
Hi, Jim. If I could I have no report from finance. I was having a little phone issue.
oh, no, not a problem. Anything new from State EMS Council?
They meet in July, 2 weeks from now.
Sounds good. All right, I don't see. And with that, we can probably go right to awards. You want to take it, Carol?
Okay, so we put out the survey last week. Tim did that, and we had our vote for the different awards. So I've got the results of that. For BLS Provider of the Year, we've got Jacob Hauk. ALS Provider of the Year is Ariel Pellegrino. EMS Agency of the Year will be Edinburgh Emergency Squad. Excellence in EMS Quality and Safety, Dr. Michael Broder. EMS Communication Specialist of the Year, Thomas Lundquist. EMS Educator of Excellence, Jean Trenka. Physician of Excellence, Dr. Bruce Ushkow. And Harriet C. Weber EMS Leadership Award of Excellence is Alan Bell. We also did receive an award nomination, but it's for the Commissioner of Health Award of Excellence, which we don't award. I'm just going to forward that on through to them for consideration. It's from the Albany County Crisis Officials Responding and Diverting. It's for them. And actually, in reading their award nomination, I'm not too familiar with this project that they have running down there, but I'm wondering if we also received an email from Val about the EMS Innovations Awards, which they're extending the deadline on that, which I'm again not terribly familiar with those either. There's apparently 4 categories in that where agencies can even self-nominate. It doesn't seem like it's got to come through the Remsco at all, but anyway, they have 4 award categories for innovation. One of them is for organizational change innovations. One is for clinical delivery innovations, and then they've got recruitment and retention and educational innovations. So I'm wondering if we don't want to maybe also recommend this entity for the clinical delivery innovations, which is innovations in clinical practices that are leading to positive patient outcomes and or positive patient experiences. Apparently they've got a program where they send mental health professionals out on certain calls to help facilitate care of those patients and not bring them into the emergency department and not involve law enforcement if they don't have to. So thoughts? Dennis is on, maybe he knows more about this program, I'm assuming. So just throwing that out there for consideration.
Yeah, and I'm as new to it as you are, but I would say, especially from the multiple category perspective, I would say, unless someone has a strong feeling that we should not, I would send it on to the state, and if it's both those categories, they're in a better position to be acknowledged in one or both.
Hey, Jim, those awards, the nominations for those awards come directly from the agency. So we should recommend that Albany County Sheriffs fill out a nomination form themselves. And certainly the Remsco or Remo can endorse that nomination, but it's not something we're supposed to send the nomination for. It's something they're supposed to send in.
Okay.
Okay, I'm sorry, I was trying to read the ballots extended out the deadline to August 1st. And she says, if you are an agency or know an agency to solve the problem. Okay.
Yeah, I mean, they can take what they sent in to us and very easily transcribe it onto just a different form.
Okay,
For it
I'll
to
try
be
to get.
considered.
Okay, thanks, Steve. It was a little unclear as to how that went. So I'll get back to her. I'll forward theirs on to Val anyway for the Commissioner's Award, which is what they were put in for. And then I'll suggest to Ms. Ruiz that she resubmit also possibly for the other award. Okay.
I think it's a great idea. You never know. I mean, the Commissioner's Award, you never know what they're going to pick. Just because we don't get to select it doesn't mean we shouldn't recommend for it.
Oh, absolutely. I agree.
Sounds good.
That's all I've got. If we still seems to struggle though getting nominees. So if anybody has any ideas on how we can further our catchment area here and get more people, please feel free to let me know. Other than that, I am done.
Thank you. County reports.
Did you call Albany County? You cut off there again.
No, I apologize. Yes.
I still couldn't hear you. Is it just mine or is he still cutting out?
No, he's cutting out. Yeah, he's calling you, Albany County.
Okay, I have nothing to report either way.
I got a
I definitely got to change technology here. Columbia County,
Nothing to report.
Greene County,
Nothing to report.
Rensselaer County,
Nothing to report.
Saratoga County,
Nothing to report.
Schenectady County,
Sorry, same, nothing to report.
great, excellent. New business was actually just the awards, nominations and selections. Old business is the continuing discussions regarding EMT training fees and the fee structure. So I'd certainly, if Steve or PJ wanted to chime in, but where we actually ended up with a recommendation from the work that this committee has done actually for quite some time is essentially where we are at is that everyone would pay up front, and then there would be two different costs associated with tuition. So books, things of that nature would be above and beyond tuition, but the two different tuition amounts would be $900 for an affiliated provider or student, and $1,300 for a non-affiliated. So unless somebody has a, I guess, whether it's Steve or PJ, if you want to make that in the form of a motion, we can acknowledge that. The other thing is, as we discuss this as a committee, we would probably leave this in place, I would imagine, for at least 12 months, possibly as long as 15 months. Over the course of that time frame, we'll take a very specific look at who the students are, where they came from to participate, and just see how enrollment and things of that nature go.
Yeah, just a little further explanation, how we arrived at those numbers. And again, we're not sure how they're going to end up, but, due to the cash flow situation with the state not paying their vouchers, we're still held hostage for about 23 grand in vouchers from last fall that nobody can seem to figure out how to pay us. Again, just to reiterate, that it becomes more complicated because we can only voucher once the student has passed. So in checking with Rich, he estimates that on an average year, he will go through 100 to 125 students per year. Our budget is basically based on $160,000 worth of income from income from the training courses. And basically we kind of backed our way into that. And again, we may be a little shy, but we felt, again, in discussions with Steve, and rightfully so, that affiliated should be given a break. We started off at 1,200 and 800, and we actually came up to 1,300 and 900, which I think was a good compromise. And looking at some of the other facilities like Hudson Valley charges $1,200 plus supplies and lab fees. And so I think that we're still in line with those. And again, we need to right ourselves with these receivables and to keep this agency afloat. And that's kind of how we came up with this. Steve, you have anything to add? I guess we keep losing them, but anyway, that's kind of where we ended up.
I mean, PJ, do you want to make that in the form of a motion? And
Absolutely. I'll make that in a motion.
And this is Steve. I'll second the motion.
Very good. So we have a motion by PJ, seconded by Steve, and that is to adjust our EMT training costs associated with payment up front, affiliated students being charged $900 for tuition, non-affiliated students to be charged $1,300. Is there anyone who'd like to vote no? Seeing none, is there anyone who would like to abstain?
PJ, I do have one comment. Would there be an option for someone who starts out unaffiliated, but then joins a service and is active during the class?
Yeah, I don't see any reason that, we couldn't issue a refund. I mean, that's more something that Tim deals with on a daily basis, but, however they paid, I'm sure we can create a refund process.
That sounds good. Thanks.
Yeah, we would definitely hope they become affiliated. That's the goal.
Yeah, absolutely. That's the goal.
Give them a financial incentive to do it.
Exactly.
We're good. All right, well, seeing no no's and no abstentions, we'll call the motion carried. I appreciate everybody's work on that and, positive comments. And it was an interesting discussion, for the very least, not wanting to put ourselves in jeopardy, as PJ said, but not wanting to upset the apple cart as it related to valuable training. The other item that I'll bring up from the floor is, as Tim had sent out to all you guys and mentioned earlier as part of his report, is that the Remsco actually, as part of their meeting, approved the program agency operating agreement. The only real change in the document that you got most recently from him or distributed, over the course of almost a year, is just a couple things, and that is that there's now a defined term. So that's in item 8, where it's a 1-year term, and it would end on July 1, 2023. Obviously, begin on July 1, 2022. And then the other component of this is the actual amount, which we have kind of discussed generally, is now included as part of this contract, and that's in 12.1. And that amount is essentially what ARMS receives, and that's $153,842. So that's what would come to Remo to operate the ARMS program agency. I actually apologize. I don't know who signed it on behalf of ARMS, but if someone would make a motion essentially authorizing whether it's the executive director or myself as Remsco chair to execute this agreement on behalf of Remo.
Jim, it's PJ. I think that the Remsco chair ought to be the signature on that. In addition to that, just to bring everybody up to speed, one of the things that Tim is doing, and it's a smart move, he and Dave, is that we created a separate checking account and accounting method for this merger, which will be totally separate from what we do right now. And I do want to get together with Tim and work out a basic budget of where we think we're heading with this. I mean, we've talked originally out of the $153,000, we talked that there should be somewhere between 40 and 50,000 to throw towards our current Remsco. But I would like to formalize that budget over the summer and make it, bring it to the September board meeting for approval.
Yep. And that's the other thing too, is obviously, we're starting this essentially in just a few days. So even though I don't think any of this would rise to the level of us actually having to have a meeting in the summer timeframe, I'm sure that whether it's from PJ or from Tim, we'll update everybody as this process moves forward.
Hey, Jim, what is the what is going to be the positions of the existing staff? Are they coming over under their current salaries to work as part of our program agency? Or are there any retirements coming?
There's and that's I apologize if that was missed at some point. No, the ARMS staff is essentially the program director, and I believe his wife assists him and also may receive some degree of compensation for her work. They are both retiring essentially with the
interpretation of this agreement. So there's no
Okay.
tab coming to Remo.
Okay, so that would lead to my second question, which is there going to be hiring of staff since Phil is retiring? I mean, obviously, a big part of that 153,000 or 150 something $1,000 was paying his salary. Is that all going to just be absorbed by our agency's current staff, or will we have to expand the staff of the program agency so we have a representative out there that would be working for us?
I think as Tim has envisioned it, it would probably be something that, as Phil said, who's their retiring executive director, he said that he feels that it could be easily operated remotely. So we wouldn't necessarily need a presence out there to have that happen. And I think as Tim has envisioned this moving forward, that the front office person would probably be, I think, tasked with some of the duties associated with, making sure information gets processed correctly as it relates to the operation of their program agency. So I think that position may be more of an executive assistant or something of that nature. Again, without Tim here specifically to speak to it, I can just tell you what his thoughts were as we had discussions.
Well, I realize Tim's not here, but I would like to ask that the staffing of the program agency be really high on the agenda for the next meeting. And the reason I suggest that is the agencies out in the counties of ARMS that are joining us will have an expectation that they receive a certain amount of service for their monies. One of the regions this merger is happening is that program agency really couldn't do it anymore. They didn't do it that well. So I'm assuming they're expecting a higher level of service because our program agency is known for providing really good service to its members. At the same time, our members are expecting the same level of service that they receive from our staff, not having that diluted. So I think it's very important that we have a plan that will, number one, make sure that the same level of service or better is maintained locally in the Remo region, and that the level of service in the ARMS region is enhanced above what it was, because the reason behind the merger is that it really wasn't getting done very well. So, if Tim feels that we could do it with existing staff, he should demonstrate for us how that would work. Or if there's a lot of money coming in. If we need to spend some of that money on having enhanced staff, whether it be taking part-time positions, making them full-time and having them cover 2 regions, or whether it be having people specifically assigned to that region, we should be paying attention to that before we do the budget going forward.
Yeah, absolutely. And as PJ had mentioned, that would be specifically part of what we would do as it relates to delineating funds for that. And absolutely, to echo your comments, is that has been part of Tim's discussions and the few times that I've been involved in those discussions, is to make sure that not only we don't dilute our mission and what we accomplish here at Remo, but that we actually do raise the level of service, for lack of a better description, to the ARMS region as we become the operator of the program agency.
Right. And, and the other thing that we have to remember about that is Tim will now have really 2 bosses, right? I don't know if boss is the right term. That's not the right term. I take that back. Tim will be responsible for satisfying, 2 masters. So, he'll be responsible for what he does with Jim, with you as the chair of our Remsco, but now he'll be responsible to that other Remsco. If that service, so he's got to work with PJ on a budget that satisfies both, and I don't know how that will work, PJ. Will that budget have to be passed by both Remscos? Will they be 2 separate budgets? We just have to make sure that the last thing we want is our new colleagues to be unhappy with us because they feel like they got sucked up. We took their money and then we're not delivering services for them.
Yeah, if I could just interject, I believe basically once we sign the agreement, okay, they do not have any say in their budget. It does come to us, that's part of the agreement. But I'd like to, yes, work with Tim on a business plan and a budget that coincides with a budget, so we all know where we stand and where we're heading, just like we do with our own. And we can
Right.
present that, we can present that as well.
Right.
He can
TJ, I saw in the agreement that we have the authority, but what I'm thinking is the last thing we need is the EMS council in that region going to the state, right? And saying,
Right.
we're not getting the service we need, because then they're going to take a look at us. So I think it's incumbent on us to work hard to have them feel like they got the value out of the money that the state is paying us to take care of them, essentially.
Sure. And I
So-
think it's going to take, a year of back and forth and making sure what works and what doesn't as well. I
Right.
think we all understand that.
Okay, thank you very much.
Can I comment on this a little bit? So when I worked in the office, Tim and I had several conversations about the possibilities, how this would work. And there is precedent for this out in Western New York, where other program agencies ran multiple regions, and whether the Remsco or the REMAC, and there's a whole combination of that. So there is definitely precedent set on how this is handled, and we have a model for best practices and also a model of things that didn't work. So I think that going forward, Tim has a lot of resources to use to formulate this. And then the other thing is, knowing the two regions pretty well, I don't think, the reason why this is going to be such a great thing is the economies of scale. And so I think that the absorption of the duties will really be a simple thing into the Remo thing. Tim may have to swell some staff to increase a little bit, but nowhere's near as like having a duplicate staff by far. So, having even one person out in Speculator where their office is probably not necessary. And a partnership probably can be built with maybe one or two of the larger agencies in the region to help with that type of thing. So there are 1,000 different combinations that will work, and that Tim has already contemplated. I know we've talked about it over the many years that I worked with Tim on this. So I am confident that this is going to go without even any glitch whatsoever, that Tim has a well figured out plan, and that the state has also providing him with resources on what's happened in other regions.
Excellent. I appreciate your comments, and that certainly is our goal, is to make it work here and prove that we can not only do it, but do it well. So I was going to say, PJ, did you, if I'm remembering back, you want to make that motion?
Sure, I'll make the motion.
All right, so I have a motion by PJ to authorize the Remsco chair to execute this agreement with Arams. Do we have a second?
I'll second it.
Got a second. I believe that was Steve Retzlaff. Anyone wishing to vote no? Anyone wishing to abstain? All right, excellent. Seeing no abstentions and no votes, we'll call the motion carried. And again, thank you guys for your patience and input as we've worked this process. And again, I'm sure there'll be additional information as Tim crafts not only the process, but the people who may be filling those positions moving forward. The only other item from the floor that I'll just bring up, I know Dr. Daly mentioned it, and it certainly is something that we're going to make every effort that we can to continue with, and that is to somehow have the ability to have remote participation in our meetings. When Tim was talking with Terry Hannigan, I said, as we're trying to do this dance with the Department of State and potentially allow this to occur in the future, I said, even if we had to call it a pilot program, and we'll blame gas prices or whatever you want to call it, but we, the participation that we can get and the time savings to everyone who can participate, essentially with a zero commute time, can't be understated. So we're we're doing everything we can to make that happen as well. Unless somebody has anything else, items from the floor.
Jim, if I may, it's Mike Daly. So two things. First of all, I'd just like to let everybody know that our EMS fellow, Cecily Swinburne, graduated, is on her way up to a community practice in Maine, where she will also be serving with the EMS community in the Bar Harbor area, and will be the medical director for Acadia National Park. So she has moved on to new venues, and we have a new EMS fellow that has just in the process of starting, who many of the folks on this call may know. His name is Warren Hayashi. Warren has been an EMS provider in the Remo region in the past. He was involved for quite a while. Now returns to us as a physician, and will be our EMS fellow for the next year, and will be engaged with this group as well. So he's not on the call tonight. We'll be on from here on out as a guest, but I wanted to make sure everybody knew how excited we are about Dr. Hayashi starting. The other is a question. So I think the merger with Arams makes a ton of sense, and quite frankly, the REMAX have been talking about doing this for about 15 years. And I'm really excited that we've finally taken this basically across the finish line. I do have grave concerns, though, about the way discussions have gone with Mountain Lakes, because if you remember, we had started talking about them and somehow that fell apart. But Mountain Lakes really exists in two parts. There's the part that feeds to Plattsburgh and Burlington, and there's the part that feeds through Glens Falls and down into the Albany area. And really, Warren and Washington County are much more a part of the capital region than they are a part of Clinton County, and an EMS operation that's designated there or out of the North Country. So I was wondering what was happening in terms of discussions with both Mountain Lakes and with the state to make sure that we correctly apportion responsible EMS territory appropriate program agencies that are working then with the geographically appropriate areas that they represent. Has that gotten any farther, Jim, or any ideas?
No, I mean, it's part of an ongoing conversation that I've had with Tim, and I think he wanted to get the Arams contract in place, and as it related to Mountain Lakes as a whole, as we reported, for reasons not totally known, they affiliated with essentially the group that's run out of Fort Drum, and it was Tim's observation, very similar to what you said, and that is that the part of their region, part of what is Mountain Lakes, is related to Remo or the Capital District region, as opposed to something as far away as Fort Drum. So I think as he has had discussions with the state as part of these program agency or Remsco meetings, not Remsco, but program agency or executive director meetings that occur bi-weekly, I believe that's been part of his behind the scenes discussions, just not necessarily to say, hey, we really think you should break up Mountain Lakes, but that's kind of where we're going in terms of a thought process, simply because geographically, it probably makes very little sense to have Washington County affiliated with something from Fort Drum.
So I guess my comment would be, I think it's important that we stand by this, that we have discussions directly with the executive director, or sorry, the director of the Bureau, about how we can more appropriately use catchment to govern EMS program agencies. And we do that before the Bureau sends out their contracts to the program agencies themselves. I think that is probably later than it should be. but I think that's something that we should make sure is actively being pursued, so that we can make sure that indeed we're looking at STEMI systems and stroke systems and pediatrics systems of care that make sense, that really are the strength of having program agencies that are set up geographically, rather than ones that were made, frankly, years ago, without any semblance of reality of hub and spoke systems. I think both from the purposes of St. Peter's and Albany Med, it makes a lot more sense if all of these things really have that type of a hub and spoke model, so we can really promote the healthcare of the people that we all serve.
Yep, agree completely, and I'll make sure that I have a conversation with Tim when he's back, and if need be, I'll be happy to do whatever he needs me to do, or if to cover something or to make sure that happens. And I agree completely. Anybody else? Items on the floor? Oh. All right. Well, I appreciate everybody's participation. Our next meeting will not be until September 26th. So enjoy your summer. We'll see you in September.